Welcome to the Phoenix Prosperity Podcast, where wealth meets legacy. Join your host, Tim Fergestad, as we explore the journeys of Phoenix's finest to success and beyond.
Hello, this is Tim Fergestad. Thank you for joining us. As the Chief Executive Officer of Adobe Population Health, Jayme Ambrose helps deliver whole person care that changes lives. Welcome to the show, Jayme.
Thank you, Tim. I'm happy to be here.
All right. So why don't you give everybody an idea of what Adobe Population Health does, please?
Sure. I'll put it in as small of a nutshell as I can. Currently, Adobe covers 11 states. I almost said 8, but on Friday of last week, we finalized an acquisition, which grew 3 more states. So we're currently in 11 states. The core of what Adobe does is we contract with managed care plans, be it Medicare Advantage plans, Medicaid plans, even ACA Marketplace plans. And we work with them to improve the quality of life of their patients or their members. And how we do that is we send individuals into their homes, social workers, nurses, nurse practitioners. We focus on what are the social determinant of health issues that are impacting their health. For example, do they have enough money for food? Can they pay for their medications? Can they pay for their utilities? Are they in safe housing? And we address those issues first. Okay. And we work with them to then help to improve their health as well. So we're also obviously doing physical assessments. We're doing checking their blood pressures and their blood sugars, and we're doing all of those things at the same time that we're focusing on that quality of health. And what we've been able to show is through the data that we've gathered is that once we improve that quality of life or address that social risk, our health costs go down by 32% on average. Nice. So for an aggregated population. So that's what we've been doing for the past 8 years.
Excellent. That's beautiful. That's awesome. I think you don't hear about a lot of that, frankly, right? You hear it because that feels like preventative, right?
Yeah.
And a lot of people, the argument is that insurance and a lot of big payers don't want to go that route, right? Because it's hard to justify, right? You need metrics and other stuff. It's not easy to quantify. So that sounds like maybe one of the bigger challenges you have or had to get in those contracts, or how does that work?
Yeah, it is, but we're also an IT company. So we build our own software and we have a huge data analysis team. And so we're able to readily show that return on investment for them.
Nice. Well done. Was that like the foundation or the basis for Adobe?
From the very beginning, we knew that we needed to be able to prove the concept, right? Mm-hmm. If the thesis is if we improve quality of life, healthcare costs are going to go down, then we have to be able to prove that we can reduce those costs. And then and also, the data that we're getting, the claims data that we use to do that analysis is all coming from the plan. So we're using their data to prove our concept.
Okay, that's awesome. That helps.
Yeah. Yeah.
Okay. So, and I mean, there's a number of factors there. So of a multifactorial equation, you have, I'd say even just you're going into their homes. That's a social aspect, which people are becoming more aware of how important that can be alone.
Absolutely. Yes.
What made that popular again, like a couple of years? Oh, the Blue Zone studies, right?
The Blue Zone studies, and then there was an awesome article out of Harvard that it was a longitudinal study that said that the ultimate result of that, as far as life expectancy, was how social you are.
Okay.
The more isolated you are, that shortens your life expectancy. So that's another key piece to it.
Sure. And it's not entirely well, I don't want to get into the weeds on my side. I'm an ex-scientist. You can't turn that off. But okay, yeah, it's obviously really important, right? For quality of life and there's another Harvard study where you are sort of the average of the five closest people in your sphere of influence, right? So if you're getting out with other people who are doing things, you're more likely to get out and do things, right? If you sit at home, you're
Right.
not. Um, Anecdotally, because it's good or bad, right? If all your five closest friends all start biking, odds are there's like an 80% chance you'll start biking, right? If
Yeah.
they all lose weight, you're much more likely to lose weight. If they all start doing heroin, you're really likely to start doing heroin, right? So it can go either way.
Yeah, unfortunately, it probably goes both ways.
Yeah, yeah. But okay, so wow, so that's incredibly impactful and powerful stuff. Is it been challenging to find margins that work for you in that space?
No, not really. How we set up our costs are really based on the number of individuals that were assigned in that contract.
Okay.
So we really look towards we have ratios that are built into social worker can manage this many patients and
Okay.
RN can manage this many patients and our MAs or our what we call care navigators, they can handle this many patients. This is how many patients a call center a call center person can make on a daily basis. So we have algorithms that allow us to then identify what our costs are going to be, and then
Okay.
we're able to make that work.
Okay. It's got to be a little bit of a challenge when you're dealing with people, always is, but if you to be in their house and being social while still having a quota or being on the clock for how many visits, right? Just like a doctor's visit, right? It's like they want to talk to you and help you, right? But the reality is I got other stuff and other people to see, right? So
Yeah, but we're very flexible with that.
okay.
For example, you schedule a social worker to go into a home, you know that they're initially you know that their struggle is that they don't have enough money for food.
Okay.
And we found that out through an initial phone call, right? Well, the social worker gets in there, and not only do they not have enough money for food, but they don't have a functional bathroom, or they're a hoarder, or there's health issues that need immediate attention. So schedules have to be adjusted. Yeah,
Sure.
you can't. Absolutely, we'd love for everybody to see X number of patients every day and meet those numbers and all of that. But the patient always is going to come first, and their needs are always going to come first. So
That's
that's
awesome. That's that's a quite the challenge nowadays.
yes, yeah. But we're a very mission driven company.
Well,
Our
that's why it's
mission,
hard because these are all caregivers, right? They inherently want to just hang out and be friends and make them comfortable and make them feel better. And
absolutely,
they find they get
absolutely.
rewarded by helping other people too. And that's hard to,
Absolutely. And we focus on the mission to positively
awesome.
impact the lives we touch, and that's what drives the company.
Now, okay, let's talk geographics. You're based here?
Yeah, we're based here. We're what is this called? North Central Phoenix.
Okay.
So just at Glendale and 16th Street. That's where our offices
Okay.
are.
Okay. And how many of your contracts or clients or how many people do you service in Arizona compared to the rest of
In
the market?
Arizona, we have probably, it's our, obviously because we started here, it's
Right.
our largest population. So I would say that we have, altogether between Medicare, Medicaid, and the multiple contracts we probably have over 100,000 lives in
Oh,
Arizona.
wow. Okay. And how has that grown since you started?
When we started, we had one county in southern Arizona and 4,000 lives and 12 employees.
And how many employees
Now,
now?
Now we have over 400,000
Wow.
lives and for right around 450 employees in 11 states.
Okay. Wow. Wow. And what are the new states, by the way? Where are you branching out into?
The new states, well, we started in Arizona, then we moved to Nevada, and then from Nevada, we picked up Louisiana, Indiana, Mississippi. Um, we're now in California and Oregon. I know I'm going to miss one. Oh, New Mexico. New Mexico is a huge population for us. And then we just picked up Illinois, Tennessee, and Florida.
Huh. Okay. Okay. How does that work? I mean, I obviously you had an acquisition there, and you got the last three from a different group doing something similar. Is that right?
What they do, yeah, it's very similar. They do case management, which is, the core of our business, but it's from a respiratory therapy based
Hmm.
standpoint. So if a baby comes home and they're on a ventilator and they have a trach, then we send in a respiratory therapist case manager to help
Right.
monitor them. We put them on 24-hour monitoring, and then we help to get them off of that equipment as quickly as
Right.
possible.
Okay. Okay. What are some of the misconceptions about your service?
I think the one of the big misconceptions or maybe historically was that we were just going to go in and we do simple tasks, right?
Okay.
I need a plan would say, well, we need just somebody to go in and do vision screening. Well, we're going to do vision screening for you, but everything we do we have an app. It's called Maslow, and what Maslow does is it asks questions related to social risk, so 10 questions related to social risk, and then it geolocates the closest resource for wherever that is. And so when we go in and do that vision screening, then we're going to let you know as the plan, we're going to let your case management team know, hey, this patient doesn't have enough money for food or they can't afford their meds. And we're then going to give that responsibility to you. And so we're not just going to do one task. Anything that we do is going to combine that addressing of social risk with it. And if you find that you can't meet those needs, then we'll take on that case management or care coordination for you
Hmm.
to help make sure that those services are met. And that's really how we've grown.
Okay. Okay. So I mean, you're trying to do a more holistic service for the
Yes,
people.
absolutely.
Um, are there certain markets? I'm still geographically thinking. Markets that are less amenable to your services,
Not
rules,
really.
or programs, or
No, there's not really any geographic. I mean, we started in the rural areas, and the rural areas are really where the highest amount of poverty
sure.
exists. So that is what makes it good for us. But we cover in the entire state and in entire states through in the
Okay.
different states.
It
So
can be pretty hard to get out to some of those spots, though. That's you said that's good for you, but it also seems like a challenge.
it really surprisingly has not been a challenge
Hmm.
because again, in those areas, there's not a lot of opportunity for jobs. So we're coming in and we're hiring staff, and we're paying them market, and we're providing them with good benefits and a 401k and educational reimbursement, and
Nice.
paying them for mileage. So
Okay.
we're creating opportunities in those
Okay.
communities as well.
Yeah. Yeah. Okay. That's awesome. That's awesome. And what's sort of the the reimbursement or the you said you're with Medicare, Medicaid. What are the programs and what's the budget for how many people you can do and how is that covered or paid?
Well,
You know what I mean?
we can do however many, because generally we get paid a per member per month rate.
Okay.
So as I said earlier, we're gonna know if we get, let's just say we get 10,000 lives, then we're gonna know immediately based on our algorithm how many social workers we need to hire, depending on the contract, how many RNs or NPs that we need to hire. And so it's really just there's no amount that we can't manage. It's just, how
Sure.
determining. And we also look for hotspots, right? So we get a geographic listing of where people live. And so like, okay, well, there's the largest population is in this county. This is the county we're going to hire the most people in. So it's all put together based on the data that we get.
Okay. I guess I'm trying to figure out. I get that there's need everywhere, but how did they get connected with you?
Oh, yeah. Okay. So how they get connected with us is if we're delegated a population or we get a
From
list
who?
from the health plan, right?
Okay.
So from the health plan says, okay, we want you to take over, we want you to manage this population of, let's say 20,000 people.
Okay. Let's back up another step. Are there other providers like you providing the service for plans?
Not exactly the way that we do.
Right.
There are other providers that are doing pieces of what we do. This is what we've found and what we've been told from other people who look at what we do, but not everybody does the whole breadth of what we do.
Okay. Sure.
So,
There's paint me a picture here. There's a group of people or a county of people that are underserved or need help, and their plan knows it and isn't able to help them when they have requests or something. How does that work? How do they determine that?
well, so healthcare is very convoluted, right? That we can agree on that, right?
Sure. Oh yes. And then some.
Okay. Okay, so when we're brought on to work with a plan, we become a benefit to
Mhm.
those members, right?
Right.
So it's of no cost to them for us to do what we need to do or are being asked to do to support them. So as that population and what they're looking at when you say I'm looking at a group, it's not so much they can't meet their needs. It's that, okay, we have this group that we're spending a lot of money on high cost claims, a lot of hospitalizations, ED utilizations. Well, again, the data shows 86% of the time, the reason that someone goes to the hospital is because of a social risk, right? They
Okay.
can't afford their meds, they can't get to their doctor's appointments, etc.
Okay.
So we are then assigned that, we'll just say county, and within that county, we have 4,000 lives that are given to us, 4,000 individuals. And again, and so we then are responsible for contacting all of them, working to identify, what's happening that's causing the readmission rates, what preventative screenings do they need to have done, so that we can help manage their health, and then collaborating with their primary care providers as well to get them in to see their primary care provider on a regular basis to help them
Right.
get their medications, all of those
Okay.
things.
Okay. Now I'm with you. I was a little uh, confused on that aspect of the system. Okay, and that's an incredible benefit. I still am just super excited about it. Okay, Okay. Okay. Very cool. Very cool. And so what are the challenges you're dealing with now in Adobe, trying to grow it or just trying to provide the best services you can?
Well, I think the biggest piece that because we're, as I said, a very mission-driven company. So as we grow, every time we grow, every time we add another state, it's number one, how do we ensure the that 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 what's going to happen there is matching what's happening everywhere else, right? So that it's a turnkey and everything
Okay.
is flowing, which
Right.
which we're able to do because of our software development
Right. Great.
and because of
SOPs.
our right and because of our SOPs and our data management. But the other crucial piece is ensuring that the culture of the company continues to be as consistent, no matter how big we get. Because the culture for Adobe is the lifeblood of
Yes,
what we're able to do. So
for
just
sure.
as the example we were talking about before, right? If our culture was not a mission driven culture and um, we had this social worker had 6 people he had to see that day, right? Doom,
Mhm.
doom, doom. You have to see these 6 people. But he walks into a home and here's an elderly couple with no food and
Right.
in need. If our culture is not take care of the person in front of you first,
Mhm.
versus doesn't matter, you've got 15 minutes then and get out of there, then we're not doing what we set out to do, which
Right.
was improve the quality of life. So that's why it's crucial that everyone from the people on our contact team to the people going into the home to our executive leadership all believe the same thing, that we're there to make a difference. And
Sure.
so that's I think that's the if anything were to keep me up at night, ensuring that every employee that we have thinks that way, that's a crucial piece.
Awesome. Okay, I would that's a challenge at most places, right? Keep maintaining culture. I would think that it might be easier for you because you're already working with people who are caregivers, right? This is a special person, special type of people who want to do that. Do you think so, or is it just as challenging as elsewhere?
I think it can be just as challenging. I think
Okay.
it can be just as challenging because everyday life gets in the way, and there's always the pressures, right? All of our leadership have budgets that they have to work towards, right?
Sure.
And
Sure.
and so and our data team and our software developers aren't really caregivers other than
Okay. Yep.
codes.
Yep. Fair enough.
Uh,
Okay. Yeah.
so, uh, but they all get it, right? They all
Sure.
get it.
Yeah. The
So
numbers are people.
exactly, exactly.
Okay.
I O is a human being.
Yeah. Like the
So
Matrix. You gotta read it.
right.
Okay.
So
Okay.
yeah. So it's I mean it's just something we really work on a lot.
Okay. Yeah. Excellent. That's wise leadership to be sure.
Well, thank you.
Can you speak to some of the bigger goals you have for Adobe right now?
Yeah, obviously the goal is to continue to grow, either through contracting or through acquisition. Our belief at Adobe is that how we deliver healthcare is how healthcare should be delivered, and that health equity is crucial. And if you want a healthy population, then you've got to address those gaps that are prevalent. And I think we obviously care for all ages. We have an entire perinatal program that all we focuses on is moms and babies in New Mexico,
Okay.
and we're doing great work with that population. And really, again, it's applying the same model. Does the mom the pregnant mom, does she have enough food? Is she able to get her supplements? Is she able to get to
Right.
her visits? We went into one home and the mom had a newborn and two small children and no working stove,
Hmm.
right? So we worked to get that stove replaced and get her, get what she needed to support her. And, so then you're reducing the risk to that newborn, right?
Yep.
Of failure to thrive because of the lack of adequate cooking. And
Yep.
so it doesn't matter where we're at. It's the same premise.
Okay. Okay. Is there an aspect of marketing you need to do, or do these plans come out to you and they find you? Is it referral based? How does that work?
Historically, it's been a lot of word of mouth.
Okay.
This year, this is our seventh year. All of our growth up until this year has been really me meeting with plans and other plans recommending us to other plans, or we meet people at conferences and then they'll call someone and say, "Hey, is this true? What she says? Can they really do this?"
Is that
But
is that
this,
is
go ahead.
is that like a bunch of them at the conference are like, oh, finally somebody fits this need we have, or is it, that's a an ancillary service that could be beneficial that I hadn't thought of? Is it a little both?
I think it's a little of both.
Okay.
I know that health plans have a bad rap, but all of the ones that I work with and the people that I work with, they really do want to make a difference. They want to make they if there's somebody and if there's someone like Adobe out there who can make a difference and they are able to see that and hear the stories and also see the money as well, then I think they're willing
Right.
to take that risk.
Yeah, they can. Yeah, if they can save up to 30% and provide better value and care to their people, it seems like a pretty simple offer.
Right, and because we do what we do, it also retains them with that health plan, right? They're not changing health
Right.
plans.
Right.
So that's also a win. But this year, we did hire our first marketing person, so we've got
Okay.
somebody else focusing on sales as well.
Okay. Okay. And I imagine that's sort of B2B stuff. It's not really trying to going after the end user, trying to tell them to ask their plan for the
No,
service,
yeah,
right?
it's total B2B. It's total
Okay.
B2B. Yeah.
Okay. Well, I don't know. Maybe at some point you get Adobe's big enough, right? Do you do some PR stuff and brand awareness and
Oh yeah, we do that. We also have a PR group that we work with. We've been working with them for over a year, so
okay.
um, there's a lot of branding information that gets put on LinkedIn and press releases and all of that. I mean, we just made the Inc. 5000, so that was
Nice.
yeah, third year in a row.
Congratulations.
Yeah, third year in a row. So that was pretty amazing.
Excellent. Excellent. Very cool. Awesome. This is all great stuff, incredibly impactful. So I always love that stuff. Thank you for sharing. Do you have any exciting plans or initiatives for for the rest of 2025?
I think the biggest, my biggest goal is really to expand our perinatal program. That's
Okay.
really what I'm focusing on, and pushing when I go to meet with plans. We've made such great strides in reducing NICU utilization, reducing preterm births, and improving birth weight that within the population that we're serving, that we're just so excited about the model and what
Right.
we've been able to accomplish with it. That's really what I've been pushing a lot. And then obviously our new acquisition and how do we blend that into what we're doing and how do we start marketing uh, that program as well. They
Right.
made quite a reputation for themselves as well. They're have done amazing work with the reduction in time that individuals who are on trachs and out of hospitals, they've been able to reduce the amount of time that they stay on those, which obviously
Okay.
improves life as well. So, yeah,
Awesome. Awesome.
just a little
Awesome.
bit.
Yeah, yeah, it's awesome, man. I can't think of, there's not much more impactful than that sort of stuff. So that's great. That's great. Are you trying to grow? So are you looking at more acquisitions? You gonna buy other people's books sort of thing?
Uh, potentially. I mean, there's two ways you grow, right? You get more contracts or you do acquisition. So,
No,
we'll see.
they're not mutually exclusive, right? You can do
No,
them
no, no,
both.
no. We've been doing both at the same time. So,
Okay.
that's we acquired a company called contracts within a company called MedZed took over a portion of their business, their house call business in California. So that's what grew us in California last year.
Okay.
And then a small company in Indiana, and then this third acquisition that just
Well, it
happened.
sounds like you have your systems dialed in pretty well. Do you have growth goals? Trying to just keep serving as many people as possible each year, maybe what, doubling or 50% growth? What's
Well,
realistic?
we used to easily do 50% growth, right? Because you
Oh,
go from
nice.
1 to 2, that's piece of
Yeah.
cake
Yeah.
there. Last year we grew from 2 to 8.
Okay.
So
Huge.
yeah, that was huge. So this year, we've already picked up 3. We're working on contracts in 2 other states. So
Okay.
see what we can.
So get up to 1 million lives?
Uh, I think it's doable. I think it's
Ex
easily doable.
Oh, yeah,
Yeah.
I'm confident in you for sure. Very cool.
Thank
That's
you.
awesome.
Thank you.
Okay. Well, Jayme, if people would like to connect with you or learn more about Adobe, where should they go? What can they do?
Absolutely. They can go to adobepophealth.com. That's our website. They can learn about us there. And then obviously I'm on LinkedIn. They can
Mhm.
connect with me through LinkedIn as well. And I'm happy to connect.
All right. This has been great. Thank you, everybody, for listening and watching. Thank you very much, Jayme Ambrose, for joining me today. We appreciate you sharing your story and insights into success, and your services are awesome. I love it. I can't wait to see more. Thank
All
you.
right. Thanks, Tim. I appreciate you.
Inspired by our guests? Visit phoenixprosperitypodcast.com/guest and join us on the show and share your success story with Tim. The spotlight awaits.